The heart has 4 chambers, the upper chamber and the lower chamber. The upper chamber is made up of the right atrium and the left atrium, while the lower chamber is made up of the left ventricle and the right ventricle. Okay, so how it happens is that, let me put it this way, the oxygenated blood, that's blood that doesn't have oxygen, blood that has been exhausted of oxygen, comes from the trunk and also from the head and enters into the right atrium. Let me put it this way. This is where the heart is. Or maybe so that you see it well, so I may go lower so that you understand what I mean by lower. Alright? This is where the heart is. We have the right atrium, we have the left atrium, that is the upper chamber. Then we have the right ventricle and we have the left ventricle. Okay? So the oxygenated blood, as in blood that doesn't have oxygen, is coming from the trunk and from the brain, from the head, and is entering into the right atrium. Take note, the right atrium is receiving. So in fact, the upper chamber, they are all doing receiving. Receiving of oxygen-rich blood or receiving of deoxygenated blood. So the right atrium is carrying oxygen-low blood, that is deoxygenated blood. Okay, then it takes it to the right ventricle. From the right ventricle, it now goes into the right atrium. Okay, so the right atrium is carrying deoxygenated blood, that's blood that doesn't have oxygen. Then it takes it in, it enters through the tricuspid valve and enters into the right ventricle. From the right ventricle, it passes through the pulmonary valve and goes back to the lung. From the lungs, it receives oxygen and goes back into the left atrium. So the left atrium is receiving blood, and this blood this time around is carrying oxygen. So this left atrium now passes through the mitral valve and goes into the left ventricle. Remember that is the left ventricle. That is where we are centering this talk on. It enters the left ventricle. The left ventricle is the main pump where we focus our interest on. That is the main chamber where we focus our interest on. Once it enters the left ventricle, it goes out to our body tissues and organs and cells through the aortic valve. Meaning that it goes from the left ventricle into the aorta. From the aorta, it now goes into the arteries that will carry the oxygen-rich blood to the brain and to the rest part of the body. So I'm going to show you the image so that you will understand it better. Maybe what I'm showing you here, you are not getting it properly, okay? But by the time I'm showing you in the image, because it is an image, it is mirrored in the opposite direction. So what I mentioned that the right atrium is on this side, but you are going to see it on the left side on the screen, but it's just like turning in the opposite direction for you to better understand. So don't get confused. Let's go and look at the screen so that you own this knowledge and it will help you to understand what happens when there's a malfunction of all this process. Okay, so we are looking at the heart chamber. And we said that the heart has 4 chambers. All right, the right atrium, the left atrium, the right ventricle, the left ventricle. All right, this is the upper chamber and this is the lower chamber. We are seeing these chambers divided into 2, one carrying blue and the other one carrying red. All right, it is used, the blue color is used to depict blood that doesn't have oxygen in it. Blood that doesn't have oxygen in it. While the red color is depicting the blood that carries oxygen in it. All right. So this is I'm still going to show you a better image, but this is the right atrium. Sorry, this is the right atrium that it's coming from the trunk, from here and from here. This is we'll call this the inferior vena cava, and this is the superior vena cava. They are carrying blood. This is coming from the body, that's from the trunk. This is coming from the head. Okay, and it's carrying blood that doesn't have oxygen. Then there's a valve here. It now enters into the right ventricle. From the right ventricle, it now goes into the lungs. it goes into the lungs. There's a valve here. It goes into the lungs where it receives oxygen. As it receives oxygen, it now enters the left atrium. Okay, from the left atrium, there's a mitral valve here. It now enters into the left ventricle. From the left ventricle, there's another valve here called the aortic valve. That's how it enters into the aorta. From the aorta, it leads to the rest part of the body. Okay, so basically the right atrium, the left ventricle, they are carrying deoxygenated blood, while the left atrium and the right ventricle, they are carrying oxygenated blood. Okay, let me explain it better with this image. Okay, so this is the trunk where oxygen low blood, deoxygenated blood is coming from, and also from the head. Okay, also from the head. All right, so the blood enters into the right atrium. This is the right atrium. This region is the right atrium. Okay, this is the right atrium. It also enters here into the right atrium, and this is the tricuspid valve through which it enters the left ventricle. Still deoxygenated blood. Now from the left ventricle, remember ventricles pump out, atriums receives. Okay, so the right ventricle pumps it into the pulmonary artery. So pulmonary artery takes it to the lungs. Once it gets to the lung, it receives oxygen. Then it enters the left atrium. It enters the left atrium, carrying oxygen in it. All right, from the left atrium, it enters the left ventricle. This receives, atrium receives, ventricles pumps out. Okay, so the left ventricle, which is our area of interest, the left ventricle is the main pump that connects to the organs of the body. All right, so this is carrying oxygen-rich blood, and it's supposed to pump just to third if the heart chamber is working well. It's supposed to pump just to third of it in one heartbeat. Okay, so as it leaves the left ventricle, it goes into the this is the aortic valve. From the aortic valve, it goes into the aorta. From the aorta, it goes to the brain and to the rest part of the body, tissues, organs, and cells. All right, I believe this will help you understand better how the circulatory system flows, carrying oxygen and nutrients to different parts of the body. Okay, so now let's look at the result analysis. Looking at the normal range for stroke volume, the normal range is from 1.338 to 1.672. 1.338 to 1.672. Okay, thankfully this particular result is on normal, is within the normal range. But if the result is on moderately abnormal high or severely abnormal high, it's implying that the heart pump is working too hard. It's implying that the heart pump is working too hard, like the left ventricle that we talked about. Okay, so it's implying that it's working too hard and can lead to heart damage or even possibly stroke. Okay, but if it is on moderately abnormal low or severely abnormal low, is showing that the body is not being properly supplied with blood. It means that the tissues, the organs, the cells are not being properly supplied with blood. It implies that less than 2/3 of the volume of blood that is going out there, which is not enough and can lead to life-threatening problems. Okay, when the body is not receiving sufficient oxygen, is not receiving sufficient nutrients, then there will be malfunctions. This is where you begin to have organ dysfunction, tissue dysfunction, inflammation here and there, and so on. So that is what we have for interpretation of the result. Now, when it comes to lifestyle, I would recommend that you maintain a healthy diet that is low in cholesterol, low in saturated fat, low in salt, okay, because this will help to keep your blood pressure under normal control. Then be given to normal exercise regularly, all right? Then eat smart, take things, supplements like garlic, take supplements like coenzyme Q10. They will help nourish or improve the stroke volume to be at optimum performance. So that's what we have for stroke volume.